And then if you start getting sick, you can get the ticks tested. And this particular kit is going to be for Borrelia, which is Lyme, Borrelia burgdorferi, Bartonella, Ehrlichia, and Babesia. Pretty cool. I don't know how much they're going to cost yet, but I basically I'll be one of the physicians in this community that says we can see these people and take care of them, because you need to be seen promptly.
How long does the tick have to be on you?
I don't know.
Okay.
They certainly have to, they can't be just taking a walk. Okay? I was always taught that for Rocky Mountain spotted fever, they had to have a blood meal. So they had to, this is UVA, they had to be on you for at least 6 hours, and they had to poop after eating. Okay? And it was the mixing of the stool with their saliva, and that's how you got Rocky Mountain spotted fever. I'm not certain that they've worked that out for Lyme disease. I'm real comfortable with that. So that if you get one night and you wake up the next morning, you need to be treated, or not treated, but you need to be watched.
And how do you tell how long it's been there? I mean, other than
You don't.
okay.
That's the problem.
Okay.
If you find if it's red around the area, okay, then it's been there for a while. It's probably been there over 24 hours. So you really do need to do a full body scan after you have been outside, and that includes your scalp. And I really think someone else has to help you do that.
You just hit on a couple things. I'm originally from the Northeast,
Mhm.
and I did go up because I got so sick down here, and the protocol is 30 days of the doxycycline minimum. And
Good.
down here, it was 10 days.
Yeah.
And also the way you were right about everything so far that you've said is absolutely right, because I was familiar, because I am from the Northeast, where Lyme is much more prevalent.
Yeah.
And the only thing that threw me was when I got bit, it didn't present like a tick. It got really swollen and itchy. And I just kind of kept putting stuff to draw out the stinger.
Mm-hmm.
And then I saw a rash afterwards. But you know,
Mhm.
that to me was something that nobody talks about, the different ways that, you know, you should recognize it. It's not just a little black dot, which is what I thought.
Well, and remember, it depends upon what time of year it is, because
Okay.
the nymphs are what you get bitten by in the springtime.
Okay.
And that's when people don't even know they've gotten bitten, because they are teeny tiny.
Yeah.
Okay, by this time of year, you can see them. They're ticks. Okay, and then there's another crop of the nymphs again in the fall.
Okay.
So it's easiest to know that you got bitten by a tick now.
Mhm.
Okay, not so much in the fall and not so much in the spring, because they're smaller.
Thank
Yeah.
you.
Yeah, thank you so much, that's very helpful. The, I think that the ILADS people have, and what I did, that was the other reason I had this. Y'all need, you have access to ILADS, and you have access to the international, not the international, the Infectious Disease Society of America. You can look up both of those, and you can look up the ILAD protocols, and those are updated on a regular basis, primarily by Dr. Burrascano. And I think it's very frustrating.
It is.
Yeah,
The
certainly.
doctors-
And the problem is that it's such a tremendous loss to society. I mean, quite honestly, I mean, you can pay now, okay, by treating people aggressively early on, and have a broader perspective and say, okay, to me it's, well, what's it gonna hurt if we went ahead and treated everybody for 30 days or for 2 months? What's it gonna hurt, and how much is that gonna cost? It's not gonna really cost a whole lot.
There's many billions they're trillions they're wasting on
As
everything else.
opposed to trying to put a family back together after someone has been sick
Mhm.
for God knows how many months or how many years, etc. And that person's loss to society is that, you know, if you get the flu in the middle of the summertime, and it's not flu season, think Lyme. All right, because that's how Lyme can manifest in the summertime. I mean, it can present itself as a viral illness. Headaches, low-grade fever, achiness, don't feel good, etc., etc. I mean, the main symptoms of chronic Lyme are pain, poor sleep, and fatigue. That's all you need. You need that triad for a diagnosis of chronic Lyme. I'm checking more and more people, and even as I did this, as I reviewed all this information and was writing this article, I realized I need to be testing so many more people to see if they have Lyme, because I realized I'm probably missing some people, because I see lots of people with neurological problems, but it presents as Parkinson's disease, as ALS, as MS, heart block, Bell's palsy, all kinds of inflammatory joint problems, you know, rheumatoid arthritis, back pain, etc. There are a lot of people who have it, and it's just not recognized. Let me see. All right. The other things that I mentioned that frequently complicate people getting well have to do with the ability of Lyme to change shape. Lyme is a pleomorphic organism, and probably many bacteria are, but it is a pleomorphic organism, and basically that means that it can change shape. So that one of the reasons it's able to last in the body is it's able to hide from the immune system, because it's able to change from being like a corkscrew spirochete to being a cyst. And it can go inside your cells, and it completely changes shape. And we don't really have any good way of diagnosing that cyst. We don't make antibodies to it very well. We make antibodies to some degree against the spirochete, but not against the cyst. And one of the huge breakthroughs was recognizing that it does go into this altered form, and that things that we use for treating protozoal infections like Giardia, okay, which is an infection that causes diarrhea. Drugs like that are used for that, so like metronidazole, Flagyl, is very frequently helpful in terms of treating the cyst form. And of course, the Infectious Disease Society of America does not believe there is a cyst form. All right, and yet we've seen the cyst forms. We've seen it in with microscopy, things like that. It does exist, and people demonstrate that when we give them Flagyl, right, they have terrible Herx reactions. So that we're killing off something, and they feel better after the Herx. They are deathly ill for a little while, but they respond to it. The other thing is that the cyst form really responds very, very well to hyperbaric oxygen. So that's one of the things that we do with Lyme patients, is that we have a hyperbaric unit, and so people can get hyperbaric treatment, and that is just one of the many things that can be done, but that works against the cyst. Artemisinin also helps to enhance different drug effects against the cyst. So there's herbs that you can use, there's oxygen, and there are drugs that you can use against the cysts. Now, some people, you try giving them the antibiotics, and all they do is get sicker. They can't tolerate it. You know, they feel lousy, but they just can't, and they get even sicker. And that's going to be because toxins are being released as you kill the germs. And frequently they're neurotoxins. So you're more fatigued, and you have more brain fog, or you have more headaches, or you have more numbness and tingling in your hands. And then what you have to do is you have to go very gently with it, but still move ahead. And you have to give people binders. You have to give them things that will bind up these toxins and help them eliminate the toxins. So you have to support liver function, because the liver is basically going to clean out all of these germs that you're killing and all the tissue that has been damaged by them. Your liver is going to clean out all of that. And you have this wonderful small intestine that's about 18 feet long. And we think of the small intestine as being an area where we digest and absorb our food. And that's right. That happens in the first 6 feet of our small intestine. What happens in that other 12 feet of our small intestine? Blood is going into it to feed it, okay? And we are dumping toxins into our small intestines, directly into our small intestines, not just through our liver. So if you have clay, if you have, chlorella that I have over there, if you have microsilica, there's a number of different things that if you have it in your gut, it will bind up these neurotoxins. This is also what they do with, and this comes from the literature on dealing with mold, because you have to have binders in the gut when you start killing off mold and they release all the mycotoxins. So the same is true for the neurotoxins that are released by the Lyme organism. So you have to have something in your gut that binds to this stuff, and then you poop it out. So it's not as simplistic as I'm describing, but that's a piece of how to get people through those phases when they're getting so sick from the antibiotics. I take care of chronic Lyme, and if people do not get well with what I do for them, right, I send them to Dr. Pittman, and I'll just put a plug in for him, because he is probably the best trained Lyme doctor between Washington, D.C. and Atlanta. And he's gone out and he spent time with Burrascano, we've spent time with a number of the head Lyme doctors in New York City and Long Island and everything. So he's put in the time, and he's able to give IV antibiotics. I give some IV antibiotics, but not as intensely as he does. Most people that I see who have chronic Lyme get better. I bet 1 in 10 I have to send to Pittman. And I think that's because I take such a global approach in terms of, building up your nutrients. I think that one of the things I think that ILADS came to kind of gradually is that it's not just about killing the Lyme. It's about supporting the person getting well. And so you can give the person, I'm certain that there's some of you here who have had years of antibiotics and you're not any better. And it's because other things haven't been treated. Your hormones have to be balanced. You have to be detoxed. You have to get the heavy metals out. You have to get the mycotoxins out. If you have fungus, you have to get healthy food in your diet. You have to heal a leaky gut, which everybody with Lyme has. You have to do all of these things. So you have to take a very holistic approach to it, or else people don't get well. And so I think that many ILAD physicians are kind of backing up, and treating the Lyme is not necessarily the first thing you do. If someone's hormones are imbalanced, if they've been sick for so long and their adrenal glands are exhausted, they're not going to get well unless you support the adrenal glands. You have to do those basic things in order to help someone heal. And I'm going to stop there, all right, and answer other questions that y'all may have.